80 years ago, 16 people sat down in Bloomington, Indiana, and decided someone in healthcare needed to make sense of the money. That was the birth of HFMA. The world they were organizing had almost no rules, no standards, no shared language. Hospitals ran on faith, community goodwill, and cash, in that order. The system around them had hit its own version of an existential tipping point, hollowed out by the Great Depression and then World War II. Half of US counties had no health facility. Prolonged illness meant financial ruin. And the national debt to GDP ratio was 122%, mirroring what it is today. Mere months before HFMA formed, President Truman stood before Congress with a plea and a vision to resurrect US healthcare from the edge. We should resolve now that the health of the nation is a national concern, that financial barriers in the way of attaining health shall be removed, that the health of all its citizens deserves the help of all the nation. Timeless words. Congress delivered half of what he asked, decoupling research and infrastructure funding from his failed push for universal insurance. The Hill-Burton Act directed the equivalent of $109 billion in today's dollars to 3,500 hospitals and thousands of facilities. And in exchange, it required those institutions to provide free and reduced cost care to uninsured community members, our seeds of charity care. By 1968, that investment had financed over 9,200 medical facilities across the country. So back to our 16 courageous souls in Indiana. The HFMA founders were formalizing a profession out of chaos the exact moment the federal government began demanding that hospitals behave like accountable financial institutions. Without people who could manage grants, track uncompensated care, plan capital projects, and report to regulators, Hill-Burton would have collapsed under its own administrative weight. HFMA's founders were building something in response to disarray and the unknown. They believed that financial clarity and structure in healthcare was an evolutionary pathway, not a destination. You see, the numbers were never the point. The numbers were how you got to the people, to the community, to a healthier and stronger nation.